The U.S. government is reaching out to churches this week to help spread important health information about COVID-19 and reach out to vulnerable people in their midst. I'm joined by Scott Arbiter, a former pastor and current president of World Relief, an evangelical nonprofit that helps immigrants. Scott, great to have you on the show. So who are some of the most vulnerable in our communities that we might not be aware of?
Well, I think it's a broad number of people, right? This virus is affecting a great number of us in ways that we never anticipated. And what I've been encouraging people is to think in their immediate circle and then move out. So if we start with, obviously, family members, but then we begin to move into our neighborhoods and our communities, the isolated elderly, the nursing homes, single mothers who have sick children and have no way to care for them. If we think about people who are frightened to go out and do their own shopping because they're in a high-risk group, there are a great number of vulnerable people that as we expand our line of sight, we'll see them. And that includes people who are already the most vulnerable, that are the homeless, the immigrants and refugees who are living on life's edge already and are so deeply impacted by this kind of disruption to our economy and our health system.
Yeah. Mr. Scott, can you give us some practical ways that local churches can help these folks?
Well, I think the first thing is for us to listen to the CDC guidance and make sure that we're not infecting each other or vulnerable people. We really ought to be staying very careful about the way that we are managing our social distance. But there's still a lot we can do even while we're doing that. My wife and I were talking last night, for example, about people who are in nursing homes who cannot be visited by family now. What if we as the church were to gather people and, with appropriate distance, to circle around those nursing homes, let them know that we're there and have a prayer circle around them and let them know that they're not alone. Talk to the nursing home and ask them for the telephone numbers of people who need to have a social contact. Reach out to them. Other ways would be to fill the food banks, because many people will be going hungry in this time and they won't have the typical social nets. Or set up a group to be shopping angels, to reach out to those who really are fearful about going out to the stores themselves.
Yeah, excellent advice there. You guys are working in some of the most vulnerable places around the world. Are there specific countries, Scott, that you are keeping your eye on in light of COVID-19?
There are many countries, but the ones that we're most worried about are those who already have extreme trauma and stress because of war, violence, famine that is there. If you think about countries like the Democratic Republic of Congo, Sudan, South Sudan, those are some of the places we're most concerned about. But frankly, there are a lot of vulnerable people around the world. And so as listeners think about, again, expanding their circle, whoever you've trusted in the past, to extend your compassion and your care in the name of Jesus into the far-flung places of the world, please consider remembering those ministries and those people as well. They will be the most deeply impacted, the most marginalized, and the least able to access health and help.
Yeah, and really appreciate all the work that you guys at World Relief are doing around the world. And I'm sure that folks like, for example, in Africa, very, very concerned about this virus. Scott, thank you so much for all that you are doing on this issue.